Welcome to the Aesthetics Today podcast, the premier platform where we explore the ever-evolving landscape of aesthetic treatments, regenerative medicine, and cutting-edge beauty products and technology.
Hi, and welcome to the Aesthetics Today podcast. I'm your host, Gabrielle Richens. And before we dive into today's episode, a note of thanks to our sponsor. This episode is brought to you by Digital Aesthetics, the UK's foremost specialist agency for health and beauty clinics. Today, I'm thrilled to welcome Dr. Ruthie Olumba, a triple board certified cosmetic surgeon and gynecologist, fellowship trained in reproductive and cosmetic surgery, and the founder of Ordina, a women's health and aesthetic destination in Virginia. Welcome, Dr. Ruthie. Thank you for joining me.
Thank you so much for having me. I'm so excited because I have never spoken to a UK crowd. Actually, that's a lie. I did have an interview with BBC a long time ago, so that's exciting.
Ah, well, you're back here on British podcast. Okay, so for those, Ruthie, meeting you for the first time, how do you describe what you do and the kind of women that you serve?
Oh, that's an excellent question. So I sit at the intersection of women's health and aesthetics, and that's exciting because most of the time, women are well taken care of. At least we hope that they're well taken care of while we're pregnant. But you're not pregnant most of your life. So a lot of your life you're not pregnant, so you want things like, what kind of bra should I wear? Or, you know, I am seeing a little bit of wrinkles when I smile. I want that gone. Or I have gone through a major life event like weight loss, and now I have excess skin and I want that taken care of. And that's where I thrive. I sit there where women are able to come to me and get a lot of advice about how they look and how they feel. And my goal is to help them feel more confident in their skin while teaching them about their health issues.
Because you are uniquely trained in both gynecology and cosmetic surgery, which is really rare.
Very
What
rare.
gap did you see in the field that made you want to combine the two rather than just going in one direction?
So, to be honest, I started off my career as a fibroid specialist. So, the reproductive surgery training that I had sort of pushed me into taking care of women with fibroids. And, women that have fibroids are usually given one solution: take your uterus out. That will solve the issue. And my job, I never actually took a uterus out. My job was to take out the fibroids and reconstruct the uterus so it was useful. Okay. And if you're not sure what fibroids are just benign growths. Yes, they're just benign growths in the uterus that can, although they're not cancerous, they can cause havoc. Like they can make you bleed heavy, or they can make you have pain with intercourse, and they're pretty pervasive in people's lives. So that was my job. And a lot of the times it can actually cause subfertility, hence the reproductive surgery. So many women would not be able to get pregnant, have multiple miscarriages, or they could need a C-section because they have a fibroid in the way of the baby. That
Right.
being said, I was doing my job, doing what I do, and then a patient asked me, well, you did such a good job on my surgery. I got pregnant. Now I've had the baby. And what is this? You didn't tell me about this mommy body. Like, take it away. Take it away. Lift my breast. Give me my shape back. I feel awful. And this happened actually a number of times. And I remember a rep came to sell me. I'm not sure what it's called in outside of the US, but it's it's an in-mode Morpheus machine. So you guys probably are used to radio frequency energy being used. So I'm not sure if it's the same in the UK,
Is it
but
a
the rep
Morpheus 8?
Morpheus 8, exactly.
Right.
So the rep came to sell this to me. This was back in the day when it was first coming out. And I was like, I don't really know if I want to dive into aesthetics. This is what I do. He was like, there are a couple of gynecologists that I know who went for extra training in cosmetic surgery. and they're doing all sorts of amazing things. And here are two of their numbers. So that night, I called both of them, and they were willing to talk to me, and they shared their journey with me. And one of them told me that the biggest regret in her career was letting go of OBGYN. She only does cosmetic surgery, but she wishes that she had learned to integrate it. And the other one, I kind of stole her like life theme. Her life theme is I am a women's health, wellness, and beauty expert. And that's actually what I call myself, right?
Mm.
So these two women helped me through my journey. And as I evolved, I realized that I didn't have to do one or the other. I actually still take OB call. So I actually go and still take care of pregnant women on the weekends. I do it two Saturdays a month. And that helps me
Amazing.
to stay completely saturated. I know what's going on with women
Mm,
in every stage of their lives, and I'm
mm,
able to help. I actually really interesting. I was on call last weekend, and I actually dealt with a girl who was 18 years old. I guess she's a woman now, but she had her first intercourse and she came in bleeding heavily, like she couldn't stop bleeding. And I got to talk to her. So I still even deal with teenagers even
wow.
at this time. So it's been an amazing ride. I wouldn't trade it for the world. It has made me cry a lot. It has made me enjoy women a lot. It has made me cherish the uniqueness that women are. So I've been so blessed to have this journey.
Very rewarding
Very, very.
passion you have, Dr. Ruthie. So, when it comes to confidence, how closely connected do you find that a woman's self confidence, her sense of self, and her decision to have surgery are?
Very interesting. Most people think that people who don't love themselves get surgery. And I have found that overwhelmingly the majority of women who get surgery love themselves so much that they're willing to invest in themselves. A lot of women have done everything. And most of the time when I do it's actually cultural. Okay. So I get a wide range of patients. I have some patients in their culture. For instance, in the Latina culture in America, it is
It's a
nobody
way of life.
cares.
Yeah, they start
Everybody gets surgery. Everybody gets surgery. It is wonderful. Everyone is very, like, nobody apologizes. In my community, in the Black community, I'm also Nigerian American. So in the Nigerian community specifically, a lot of the women will apologize to you. They'll say, like, Doc, I've done everything. I've dieted. Uh, I work out every day. I do this. They actually apologize for wanting this. But I will tell you, almost every patient, even patients that have complications, end up telling me that it changes their lives for the better. I have one of my favorite patients. She's the largest breast reduction I have ever done. And I also did a tummy tuck at the same time. So when she came to me, she was very shy. She had a black dress on, and she had the most fabulous Kelly 25 I have ever seen. Okay. And she had a Hermes silk scarf on. Her hair was laid, but she was kind of hunched over. Her eyes were always on the floor. And we talked, and when she finished, she said, "You're going to take my surgery?" I said, "Yeah." She said, "I had a dream. I cannot remember the face of the person, but that person's aura reminds me of you, that you did my surgery." And she said, four other doctors had told me no, that my surgery was too risky. And I told her, "No, we're going to do this." Well, that made me a little bit nervous, but we went
Why,
ahead and did the
can I ask
surgery.
you, why would another doctor say it was risky?
Her breasts were so big that her nipples were almost on her thighs,
Wow.
like the length. I mean, so with that, there's a risk that the nipple will die. So
Right.
a lot of doctors won't want to take that risk. But there are techniques in which you could do it. And I did it. I lifted her breast, and I did. And also, her belly was so large that there are multiple vectors you have to take into consideration. But I lived in Texas at the time. And so I was used to larger ladies. And so it was fine with me. And so we did her surgery, and she would periodically send me promotions that she was getting. So she was getting promotion after promotion after promotion. And her 3 month follow-up, she came in and she had a paisley shirt on and a cobalt blue pants on and a black purse. So I noticed all of these, but I didn't know how to broach the subject. So I said, "Oh my God, your Balenciaga bag is amazing. Like, I've never seen a black bag like this." By the way, every single patient gets a compliment from me. I'm going to find, even if your ears are perfect, I'm going to find something that's perfect about you. And so I told her about her bag. She was like, "Yeah, this is her first bag that's been black that she's ever gotten ever." Because she's always worn black, but her personality, she lives life in color. And she told me something really amazing. She said, "You helped me see life in color again."
Wow.
And that confidence, 3 promotions, she got poached by her competitor company, and she became a VP of her company in her field. And
After
she
the
said, "I felt like I could speak up, I could be myself, I could be bold because I wasn't hiding anymore." So
surgery.
that to me is what a lot of women can't articulate. You feel like you're a shell of yourself. Perhaps you went through a divorce. You don't recognize yourself anymore, right? You're
Mhm.
wanting to yourself, like, if I was prettier, if I was slimmer, if my breasts were perkier, perhaps he wouldn't have left.
Mm.
Or you say to yourself that, "Oh, I've gone through having these babies and now all I watch is cartoons. I don't even see myself as a woman anymore. I
Yeah.
don't see myself as an adult anymore."
Mm.
And then you look in the mirror and it doesn't match what you see in your mind's eye.
Mm.
And then when we do these surgeries, we transform women to another level, age be damned, hormones be damned,
Mhm.
all of the things, gravity be damned. We're able to change and help women feel more like themselves, how they see themselves in their inner eye.
And do you find that a lot of your patients have just gone through these changes of maybe divorce,
100%.
weight gain? Yeah.
Mm-hmm.
Brilliant.
100%. And it's also interesting because there's the opposite. They have a name for it in the um, weight loss medication world. The GLP-1s, they call it as Ozempic divorce. There's also the opposite, where you get all of this work done and your partner now no longer understands how they fit into your life. Because
Wow.
perhaps they think that they knew you were beautiful, because a lot of the time the face card never declines, but they feel like perhaps because you're bigger or you don't look as young anymore, or maybe you have kids, that they're not checking you outside so he can do whatever. And now that you are back to looking like yourself and you're turning heads as you should, they start to get very insecure. So we see both of that, and I actually warn my patients about that.
That's so interesting. Do you also get a lot of patients coming in? I know that the Ozempic creates loose skin with the weight loss. So do you do skin removal for women that have lost drastic amounts of weight loss on GLP-1s?
I do, and I think that that's actually the future of my field. I
Really?
think that up till now, we have been fat repositioning experts, but I
Mm.
think we're going to be skin repositioning experts. It's very, very interesting that when women use GLP-1s, their fat changes, the texture of their fat. We actually call it cotton candy fat. The fat is now spongy and loosey. It changes. So those are
Wow.
some of the things that they're looking into to be able to articulate via research. How does the fat itself, the adipose tissues, change? How does your muscle age, right? Because we know that with GLP-1s, you lose
Mm.
cells everywhere. So your thighs, right, you might lose some muscle in your thighs, so maybe you're not as strong anymore, or in your back, so your posture isn't great anymore. You're more at risk for osteoporosis. So anyone that's listening to me, GLP-1s are amazing. I think next to Botox, they are the fountain of youth. However, if you happen to get your hands on GLP-1, that is the day that you have to dedicate the rest of your life to strength training, because you need to protect your bones. You need to make sure that you prevent osteoporosis, because that is important. Nobody cares if you're slim and you're bent over.
Yeah. and it's a way of life. Like, you can't just do the GLP-1 and not go to the gym and not take care of your nutrition. It's just, it goes hand in hand. I think a lot of people just do it on its own, though. I think there's a real epidemic of that. Let's get on to body contouring. So what's one of the biggest myths that you see around body contouring and liposuction that patients kind of get wrong or get
Two
confused?
things. They think it's going to be a weight loss magic, and they think that it's magic. Neither one of those, okay? So what I do, I primarily do liposuction and tummy tucks. That is my jam. That's where I live, okay? And liposuction is exactly how it sounds. Lipo means fat. Suction is sucking fat. That's all it does. That's it. And when you work out, you can't tell your body, suck fat in my belly, leave fat in my butt, leave fat in my face so I look like a newborn. That doesn't happen when you diet and exercise. So it's actually a beautiful procedure that was created for diet and exercise resistant fat. That's actually what it's created for. We are able to finagle it and use it in different ways, but that's what it's made for. And that's what it works best for. So even though people think that it's a magic pill, it's only part of the journey. And it should be part of your health journey, not the destination.
Yes. So my next question, I've seen that you're very into your health and fitness. What do women often overlook when they're coming to you just, for just fat removal, for liposuction?
Protein.
Yes.
Protein, protein. Most women believe that if they eat protein or if they lift weights, they're going to look like the people on Mr. Olympia. You don't have the genes for it. It's never, ever, ever, ever going to happen. The women who are on Miss Olympia do the most. I used to compete. My husband actually is a competitor and he's training for his next competition right now. So my husband has to wake up early to eat. He has to eat. He has to train in a specific, it's like a chemical reaction in your body. You're not doing that. Okay. So eat the protein, drink the protein shakes, drink the plant-based protein shakes, eat the meat. If you don't eat meat, figure out how to get pea protein in there, tofu in there. Find out what it is that you can use. You cannot, as a woman, you cannot afford not to fortify your life with protein. And the second thing is, we've already talked about it, strength training. Those are the two mistakes every woman makes. And if you're getting surgery, in my case, in my practice, we actually give patients the diet to eat before surgery and the diet to eat after surgery. Before surgery, we ramp up your protein intake. And after surgery, we ramp it up even more because protein is the building blocks of all tissue. So you need it for recovery's sake.
Yeah, so important. That's a great aftercare you give to your patients.
Yes.
Yeah. How has social media changed the expectations around body surgery? What are some of the least helpful narratives that you have to push back against?
Oh man, social media. So social media is a blessing and a curse because it proselytizes what we do, and a lot of people can see it. But I've heard patients say, "Oh my God, I've seen this surgery, but that's me, but that's not me. I don't look like that." So there are unrealistic expectations that are proselytized even by the surgeons ourselves. We know how to break the bed and shift the patients and, and Photoshop things to look better, right? Because this is still a very cutthroat market. But in addition to that, patients have done a lot of things that are not depicted. For instance, a patient might have a butt implant, come to me for lipo 360 the third time. I'll do lipo 360, and then every patient wants to look like her. But you don't have the first round, the second round, the butt implants, the fat transfers that she's had. In addition to that, a lot of women see somebody, the number one patient that I get, I don't want to look like this person, And I love you, girl. I love your music, Cardi B. A lot of patients are like, I want a BBL, but I don't want to look like Cardi B. And I'm like, Cardi B has multiple surgeries. You don't even have the like skin pocket, the skin window for any of this fat to fit. So there are a lot of misconceptions about what you're going to look like the first time, because people are showing a whole journey as a snippet, and you are starting and you want to look like someone's page 2000.
Yeah. Yeah, it's very misleading, super misleading. Staying on social media, on your Instagram, you're very clear that you don't judge celebrities for what work they've had done or how they've lost weight. Why is that so important to you?
Well, I think that celebrities are human beings. And that's why I preface it by saying, I love you, girl. Like, you know, celebrities are human beings. They just happen to have a loud microphone. Okay. Now, there are a lot of my colleagues and I that use them as teaching points, and once in a while I will. But it's important that we allow human beings to be human beings. And also, I don't believe in outing culture. I'm a physician first, right? So patients' privacies, even if they're not my patients, outing culture to me is so it's just for the headlines. My job is to educate. If I can use someone as an example to educate, and the person is openly talking about it, like recently I talked about the gymnast. Oh, her name is escaping my mind. She's like the world's greatest gymnast. What's wrong with you?
Her name's gone out of my head now. I know exactly.
Simone Biles. Simone
Yeah.
Biles. Simone was, I love her presentation about her breasts, right? She had some augmentation done and she talked in detail about it. Of course, I clocked it right away. You know, I'm a Simone Biles fan. And I also love the fact that she is so confident in her bite-sized body. And so for me, it was a vote to women, like, if you don't want or don't like a part of your body, or you think that you want to improve, it might not even be that you don't like it, you want to improve a part of your body, go and do it. Just the way we say your body your choice, your body your choice. And I think there's another thing that you asked me a question about, what are some of the narratives that I have to push back on. I think the two other ones, one of them is that you get surgery because you don't like your body. I've said this before and I'll say it again. Most people that get surgery actually love their bodies. And they do, and they keep up their bodies because they have invested so much. And the second thing is that, you know, surgery can kill you. Surgery can kill you. Surgery for your foot can kill you. Unfortunately, I know people who have gotten tonsillectomies, routine tonsillectomies, and that has been, it's a risk. 100% it is a risk. However, I think that is blown out of proportion because there's an underlying um, idea that everyone is doing this for vanity. And so, are you going to risk your life for vanity? But I will argue that a lot of people are risking their lives on a day to day basis because they're not living to their fullest, and we are not promised tomorrow.
Absolutely. Absolutely. From where you sit, what kind of damage do you think this constant before and after policing of women's faces and bodies does to kind of maybe like the everyday woman who, you know, might want to get surgery but thinks she might be judged?
Oh, I think that, you know, you raised a good point, because I recently saw someone talk about this where is a colleague of mine, Dr. Hamra, and he basically said that, you know, people, what damage are you doing to these women when you say, oh, she looked better before? He does faces. So she looked better before. Oh, I liked her better before. You know, it makes women feel like, I'm going to invest all this money and I'm still not going to get the external validation, which is why in our consultations and in our pre-op journey, I talk to patients a lot about their motivation for surgery, right?
Mm-hmm.
I do surgery on your external parts, but you remain with you. If you are a miserable person, surgery is not going to change that. If you are a bitter woman, surgery is not going to change that. If you're cantankerous, it's not going to change that. You remain with you. In fact, I'm going to tell you this statistic. The number one type of doctor, specialty of doctor, whose life can be ended by their patient is actually a cosmetic surgeon. And typically, the type of patient is usually a male rhinoplasty patient. And when they get into the psyche of these people who have ended the lives of their doctors, the psyche is that they believe that their lives are going to change. They're going to get this job. They're going to get the girl. They're going to get the car, or they're going to get the house. But the changing of their appearance did not change that they were a jerk.
Yeah.
And so the girl still doesn't like you because you look good. Doesn't matter. You still don't treat her well. You're still not a good person. You're still not skilled at what you do, and you still don't know how to articulate your skill set. So you remain with you no matter what surgery does. All that surgery does is going to highlight who you are.
Yeah. Yeah. Psycho cybernetics.
Yes.
I'm reading it at the moment, actually. If you could redesign the consultation process across the whole industry, how would you love to see surgeons educating patients differently?
I would want patients, that's an amazing question. I want doctors to actually talk to patients about their underlying issues. A lot of the women that are getting lipo and body contouring have PCOS. It's much more pervasive than we think. And actually, that was um, my research paper when I was a fellow. I looked at the number of women who were getting body contouring and weight loss surgery, like bariatric surgery, to find out if they had PCOS. And it was not documented in half of the patient's charts that I looked at. It wasn't even documented. It wasn't even asked about, So finding out what is going on with these patients, that it's another entry point into medicine, right? There are women who will see me that will never ever go to a primary care physician. They will never ever go to a gynecologist unless they get pregnant. So it's another entry point. It's a way that in a very calm setting, you can talk to your patients about things that they actually have, like PCOS, like fibroid, like menopause, like perimenopause. Like, why can't you lose your belly fat? Most of the time, it's hormonally related. Okay. And, or why are we doing a vaginoplasty? Well, maybe we should add, estrogen, topical estrogen to it. Are you enjoying intercourse? Do you have any problems with being attractiveness, with orgasms, with pain? Things are not discussed. So that's how I would change it. We need to practice medicine, not just fix anatomy.
So you have said that women's health needs to be, or is going to be, the next big thing and the big category in aesthetics. What are practices missing out on when it comes to women's health?
Well, aesthetic practices see 80% women across the board, anywhere in the world, right? These women come in and they say to you, well, I don't understand. My skin is dropping, right? And so you say to them, oh, I know how to fix that. I'm going to do some thread. I'm going to do a thread lift. And you do the thread lift. And then you say to her, well, you're going to come back for your Botox in 3 to 4 months. That's it. You tell her bye-bye and she's gone, right? However, if you said to her, but even though we're fixing this, you are 51, you're now are you still having your periods? They say, no, I'm not having my periods. Oh, well, I think this drop is related to the fact that your estrogen has gone down, right? Let's consider, and your testosterone has gone down. So let's consider some other things like testosterone pellets. Or if you don't feel like you want to learn about hormones, you say, can I send you to your gynecologist to take care of this? Now they associate you, once they have the testosterone and they have the zest for life, they're having the best sex of their lives. They're going to think to themselves, this person thought about me more than a transaction, more than I just got I could have gone anywhere. Now I got to go back to her because she might point me in the next direction. Maybe she'll know a little bit more about what I'm going through. And you might now become like how we have hairstylists. Everybody tells their hairstylist their secrets, right? And you might now become this person. And I want to go to my hairstylist because I got to have a kiki session. Like, girl, you don't know what's going on with me. You might become like that. So people are actually looking forward to their Botox appointment. And now you have a client, you have a patient who's not coming because they're going to trade money for a service. They're coming because they think you care about them, that you're taking them as a whole woman, not just another credit card payment.
Yeah. Yeah. And just treating the outside.
Exactly.
How do internal factors, hormones, inflammation, metabolic health, show up in surgical and aesthetic outcomes?
Oh, let's start with aesthetics. Hormones and inflammation will show up visibly. You know that because you can look at a teenager's skin and be like, oh my, there's a pothole of cystic acne here. You're going through puberty because their hormones are all over the place, right? You know that also when you see women with adult acne, they will tell you, I have never experienced acne in my life. And now they're 45 and they have acne because there is a tumultuous. So you already know that. We already intuitively know that. We probably haven't put the words to it, right? You know that if somebody is taking drugs, you can see it on their skin. So all sorts of things you will see on your skin. You know that after a woman has a baby, her estrogen drops so low so fast, she has postpartum hair loss, right? You know that. You already know it. So now it's time to act on it. A patient comes to you, they have postpartum hair loss. You now know that this is postpartum hair loss. You tell them, hey, your hair is going to grow back. However, we can help it grow back thicker and we can help it grow back even stronger than before. Why don't we add PRP? Why don't we do red light therapy on your hair? Why don't we do manual stimulation? Why don't we add um, um, minoxidil? Why don't we do? You now understand that, but you're able to talk through talk through it with them because you understand what's going on. So it is so hand in hand. And I think that we're missing that. Gynecologists are talking about it, but they don't know what to do about it. The aesthetic world is doing something about it, but they don't know how to talk about it. And I feel that both sides have a way to have a Venn diagram where there's an overlap. In fact, that's where I live. That's the only place I live, is in this overlap. None of my patients get to walk away and not learn something about their health, just a little bit more. And I would bet that if you were to poll my patients, because as you know, many patients will go from doctor to doctor and shop, right, before they go through surgery. I promise you that if you were to poll my patients will say to you, I chose Dr. Ruthie because she cares about me. I chose Dr. Ruthie because she knows my body. I chose Dr. Ruthie because I feel like she would take care of me in the way that I want to be taken care of. She will take care of me as if she was taking care of herself or her mother or her sister. So that is the vibe you want to evoke to your patients, that you're willing to do everything for them and you're willing to go beyond your limits of your knowledge to learn more. You're willing to become more of a master in what you do so that you're able to give them the best possible care.
So for clinic owners listening, Dr. Ruthie, what are a few practical steps that they could start taking to integrate women's health into their practices?
Awesome. So I would recommend that you start very basic. Look at what you do and what you do very well. If you are a person that deals mainly with women who are older, Now you know that you need to learn a little bit more about perimenopause and menopause. If you deal with the younger girls who are getting a lot of fillers, that they're getting preventive Botox, then you can start to talk to them about their life plan. Like, are they planning their fertility? Are they freezing their eggs? Just trying to integrate a little bit more about the lifespan of a woman, because the lifespan of a woman is so dynamic. And based on your patient population, you will be able to find what it is that apply to each patient population. In fact, every decade, there is something that women are dealing with outside of aesthetics that you can pull in and make it part of your practice. And then find out, if you don't want to become an expert in that, find out who you can refer those patients to so that you have continuity of care. And I bet you that will also open an avenue for you. So those people will now refer back to you. It is a hand in hand marketing, but patient care strategy.
Nice. Good advice. So let's talk about aesthetics, because you do the aesthetics, you do the gynecology, you do the cosmetic surgery. With your aesthetic practice, we've had in the last few years a lot of this whole regenerative medicine come into play, and it's very exciting. But from a clinic owner's perspective, when you hear these buzzwords, exosomes, stem cells, PRP, what actually has the evidence behind it, and what is mostly kind of marketing and hype? How do you differentiate?
I love that question, because a lot of us want new and shiny, but old and trusty also works, right? So PRP I don't live without PRP. I use PRP and PRF all the time. I use PRP in the wounds. It helps with wound healing, preventing scar formation, preventing keloids, helping with hypertrophic scarring. So 100% the literature shows that. In addition to that, it shows modest improvement in hair growth and hair rejuvenation, and also shows modest improvement and in sexual wellness. So
Right.
the O shots definitely are there. There's actually also evidence in men. So if you have a male population, this is also a way to go.
Mm.
However, exosomes, on the other hand, and stem cells are more marketing than they are evidence based. Now, the good thing is they usually don't cause harm if handled with care. But I think that that's something you should experiment with your patient population and be very clear that the evidence is still lacking as you move forward. I hope that we have more evidence to show that there's improvement with exosomes, because obviously patients that want one less blood draw or have anemia already have the option of exosomes. So that's where I kind of stand in regenerative medicine. I'm excited about the future and the technology, but I don't think that we're as confident in the results as we portray online.
Doctor, for those that don't know, can you tell us a little bit about PRP?
Yeah, PRP is platelet-rich plasma. So what we do is we draw your blood. We will use a centrifuge to separate out the blood cells, the red blood cells, white blood cells, and then we leave the platelets and the serum, the liquid part. And that has regenerative properties. In fact, I remember in medical school, we were learning about the TGI TGFs and the IF this and the this and the that and the cytokines and all of these things that are in your blood that help regenerate and rejuvenate your body, your tissues. Well, that has been now harnessed to use it in three major areas. I think it's more, but these are the ones I use them in: wound therapy and prevention, helping the aesthetic, the visual look of the wound, and just in wound healing, sexual wellness. So the quote unquote orgasm shot or O shot is actually PRP being injected in specific areas to help with having better orgasms. That is a little bit different from the G shot, which uses hyaluronic acid. And sometimes some people will actually use fat there, just like you can use hyaluronic acid or fat anywhere. And then lastly, is we use it in hair rejuvenation. So I typically use it with patients with traction alopecia, with postpartum alopecia, and it can be used in conjunction with other therapies for male pattern balding.
Wow, it does so much. You can do so
Yeah.
much with it.
Yes, I love it so much. I typically, this is how I do it for my patients. If we can get enough, like if I do it during wound healing, I always consent them for wound healing, hair, and sexual wellness. A lot of my patients will do all three. Some of my patients, they do not want to do the sexual wellness, so we'll just use it for their hair, but I consent them for all of them because we've already drawn it and I do it for no additional cost because I have it there. So we do that and you're under anesthesia, so we just get it done and get you out of there.
Amazing.
Yeah.
Where do you see regenerative aesthetics like PRP heading in the next 5 years
Oh
for
my
women's
goodness.
bodies and recovery?
Oh, it's going to be amazing. Regenerative medicine and the use of technology and AI in aesthetics is the new frontier, in addition to women's or fem health or femtech. Like all of those three are ways, if you're looking to really push your practice, if you're a young provider, I would consider myself somewhere in the young provider group because I probably have 25 years left in my career. So if you're a young provider, you want to move with you want to be an early adopter. Those are the things that you want to start figuring out is how to incorporate AI, technology, regenerative medicine, and femtech, fem health into your practice.
And another question for the clinic owners and practitioners that are listening, how could you advise clinics for taking on these very kind of new type of regenerative medicines?
I would say one step at a time, just like everything else you've built, right? A lot of people want to take on um, and if you are a really good business person, you know that you don't want a lot of capital equipment. You don't
Mm.
want to bring on more capital without having patient acquisition machines already created. So what you would do is I would start with the low cost stuff, which is really PRP. Most people, a centrifuge sometimes doesn't cost anything, at least in the US, but sometimes it might cost minimal. And then it's all of your stuff that you need to reuse, like you can't reuse non-reusable things for your patients. And then you just need somebody that can draw blood. After that, it becomes like Botox to you. You already know how you're very good with the needle.
Mm.
So so I would start 1000% with PRP because exosomes cost money and they expire. So they can't sit on your shelf forever.
Mm.
Right. And then I would wait to add stem cells. That would be the last step. So that's how I would incorporate each one.
Mm.
And what I would do is I would talk to patients about it. Like, for instance, if you want, you can have two separate approaches. You can have the approach of, and I'm talking to just like med spa owners or aesthetic clinic owners. You can either have the approach of hair restoration and you would package it with vaginal rejuvenation or vice versa, depending on what you do more. And that way you've already, like, it's going to cost you about 12, well, I don't know in pounds, but it's probably 10 pounds and like $15 or $12, something there for your materials. And then your time is the next thing, and you can charge, at least in the US, we charge 1,300 to 2,500 for each O shot that's done.
Do you advise clinics? Because you should if you don't.
I do. I help a lot of new med spa owners, particularly. Um, in the US, the way that it's structured is you typically need a medical director. If you are in some states, if you're a nurse practitioner, you don't. In many states, you do, and they're trying to make that even a little bit more universal. So I'm the medical director for medical clinics. I do not just help them sign charts. I help them with structuring, price, making sure that I mentor a lot of them, making sure that, because a lot of the biggest mistake that any med spa can do is discounting. It's the easiest thing to do because you say, oh, if I lower my prices, I will get people. And I have fallen into that myself, right? But what it ends up doing is you get shoppers, people that are not, they do not care about anything but price. And so you then pigeonhole yourself into being a budget med spa, and you will, I have never met a more demanding patient than the patient that paid you the least. They've used their life savings to pay for whatever, and they expect the highest of the high. When it's throwaway money for somebody, they're coming there because you make them feel good, you make them look good, you restore their confidence. That's why they're coming there. It's an addition to them. It's not their last lifeline.
Which brings us nicely to talking about Ordina, your clinic.
My
Now,
baby.
what was your big vision here? I know we've kind of covered a lot of it in terms of treating women's health, women's sexual health, gynecology, and plastic surgery. But what was your big vision, or the moment you realized you wanted to do this all under one roof and build Ordina?
So Ordina is very interesting because it actually spells out what it is. So AU is the periodic table chemical symbol for gold. And then Arden or Ordina is a place of restoration, is a place that you come back, is a place of new beginnings. So I wanted to create the gold standard for new beginnings for women, okay, for transformation. And that's why it's called Ordina. Fun fact, my very first job ever was working in a peach orchard in Eden, Maryland. So it was called the Garden of Eden. So we are tipping our hats off to the first place I ever worked. I was probably like 14 or 15 or 16 then, when I was a teenager for sure. And I was the girl at the peach stand. So that my husband named Ordina. And so that's how we came to this name. And so my vision and the vision of our team is that we create a place that women can come and have their new beginning. But also we hold ourselves to the highest level, to the highest standard, to the gold standard. We want to create the gold standard because, as most of you listening know, aesthetic medicine, cosmetic surgery, plastic surgery is the wild, wild west. The legislation is all over the place. Patient experience is up and down. Patient safety is up and down. And we want to hold ourselves to the highest standard. We spend our time educating ourselves, educating our patients, and educating the public at large, because it is our goal to be ambassadors for aesthetic medicine.
Absolutely. If a woman is listening and she is considering surgery or an intimate wellness treatment with you, what is the one mindset you would love her to bring to her first consultation?
I want you to come very open-minded to the idea that you can achieve what you want to achieve. And I'm not talking about surgery. I'm talking about, do you want to be a better mother? Do you want to be a more present wife? Do you want to be a boss babe? Do you want to be like my patient who moved up and got promoted and got poached by her another company? I have stories, lots of stories like that, right? It's about coming with your mind open, that the vision you have for yourself, you have it for a reason, and you can birth that. You know, women are very interesting creatures because we birth nations, we birth ideas, we birth full humans, right? Women are we have the ability to create from nothing. So you have the ability to create from nothing. This is not just about a surgery. It is definitely not going to be a transaction. It is a place that you can come to and you say to yourself, what is it that I really want to be and how can I get there? And I want to be walking in the vessel. I want to be feeling like the person that can do this. And that's my job, is to help you hold your hand as you walk through that journey, getting to birth this new vision.
Your patients are so lucky. They're getting a life coach as well as a plastic surgeon and a gynecologist. Wow, Dr. Ruthie. Okay, and finally, when you imagine the future of aesthetics practice, if we truly center it around women's health, sexual wellness, and long-term recovery, instead of just selling single procedures, what does the future look like to you?
Oh, it's so bright. It is so bright because, as you know, medicine was in the hand of men for so long. And so women's health was an afterthought. And they said, I mean, there are people today who still spew things like women are vessels for humans to come through. We are, but that's not all we are. And so I think that aesthetic medicine is that we're poised to be that frontier for women, that we're not only going to care about you while you're pregnant, we're not only going to care about you when you have when you're bleeding out the wazoo, or you have, you know, pelvic pain and nobody can help you. We're also going to take care of you when you don't like your smile anymore because it's gummy, while when your breasts start to sag because you breastfed them big head kids and now they talk back to you. You know, we're going to care about your waistline because you have been in the gym and your diastasis cannot be fixed by the gym. We're going to care about you when your intercourse is now painful because your vagina is dry. Those are all the ways that we can actually help women beyond just injecting them.
Brilliant. Thank you so much for joining me today, Dr. Ruthie. Can you please let our listeners know where they can find you?
Well, I'm on the gram like everybody else. I'm a millennial. I'm on the gram. So you can find me, and that's where I'm most present. Is I am Dr. Ruthie, I.am.dr.ruthie. Do not go with the Y. It's IE. And then I'm also on TikTok as Dr. Ruthie, DRRUTHIE. And I do have a website, www.AURDENA, and that is Ordina.com. And so you'll see some of my work. I have loads of work that I share, and I don't just share work, I share my life. I'm training for a half marathon. I share that. I share my love. I share my husband with the world because I'm not hiding the world from my husband or the husband from the world. So it has been a journey for me. And most of the people that have followed me have actually followed me since I've had that same page since, I probably was in medical school. It used to be Slim Runner 13. So I was a runner. I shared when I ran marathons back in the day, and it has evolved to sharing more about medicine, aesthetics, cosmetic surgery. And I talk a lot about relationships because all at the end of the day, for women, for men it's sex, for women it's relationships. And I'm not talking just about romantic relationships, even though we talk about those, but also about friendships and how to persevere in the workforce, how to maneuver as a woman without having to smile all the time or to be mean all the time, or we work through what it means to be a woman. Because for me, all of that is women's health.
Amazing. You're a wonderful role model, Dr. Ruthie.
Thank you.
Thank you so much for joining us. And thank you for
having me.
watching, guys. Please remember to like and subscribe, and I'll see you on the next episode.